Welcome to my channel, RX Sam 2020. Today we discuss a drug named Alprazolam. About Alprazolam is used to treat anxiety and panic disorders. It belongs to a class of medications called benzodiazepines, which act on the brain and nerves, central nervous system, to produce a calming effect. It works by enhancing the effects of a certain natural chemical in the body GABA. Medical use. Alprazolam is mostly used in the management of anxiety disorders, panic disorders, and nausea due to chemotherapy. Alprazolam is indicated for the treatment of generalized anxiety disorder and panic disorder with or without agoraphobia in adults. What is generalized anxiety disorder? GAD is a mental and behavioral disorder, specifically an anxiety disorder characterized by excessive, uncontrollable, and often irrational worry about events or activities. Worry often interferes with daily functioning, and individuals with GAD are often overly concerned about everyday matters such as health, finances, death, family, relationship concerns, or work difficulties. Symptoms may include excessive worry, restlessness, trouble sleeping, exhaustion, irritability, sweating, and trembling. Agoraphobia is a mental and behavioral disorder, specifically an anxiety disorder characterized by symptoms of anxiety in situations where the person perceives their environment to be unsafe with no easy way to escape. These situations can include open spaces, public transit, shopping centers, crowds, and queues, or simply being outside their home on their own. Panic disorder is a mental and behavioral disorder, specifically an anxiety disorder characterized by recurring unexpected panic attacks. Panic attacks are sudden periods of intense fear that may include palpitations, sweating, shaking, shortness of breath, numbness, or a feeling that something terrible is going to happen. The maximum degree of symptoms occurs within minutes. There may be ongoing worries about having further attacks and avoidance of places where attacks have occurred in the past. Dosage. Oral. Short-term management of anxiety. Adult, in patients with moderate or severe anxiety states or anxiety associated with depression, as a conventional tablet, orally disintegrating tablet or oral solution, initially 0.25 to 0.5 milligrams 3 times a day, may be increased as necessary every 3 to 4 days to a total of 3 or 4 milligrams daily, in divided doses. Maximum treatment duration, 8 to 12 weeks, including a tapering off period. Child, as a conventional tablet, orally disintegrating tablet, or oral solution, initially 0.25 mg 2 to 3 times daily, may be increased gradually if needed and tolerated. Elderly, as a conventional tablet, orally disintegrating tablet or oral solution, initially 0.25 mg 2 to 3 times daily, may be increased gradually if needed and tolerated. Hepatic impairment, severe, contraindicated. Oral. Panic disorder with or without agoraphobia. Adult, as a conventional tablet, orally disintegrating tablet, or oral solution, initially 0.5 mg 3 times a day, may be increased in increments of no more than 1 mg daily every 3 to 4 days. Doses of up to 10 milligrams daily may be used if required. As an extended-release tablet, initially 0.5 to 1 milligram once daily, may be increased in increments of no more than 1 mg daily every 3 to 4 days according to the response. Usual dosage range 3 to 6 mg daily. Elderly, as a conventional tablet, orally disintegrating tablet, oral solution initially 0.25 mg 2 to 3 times daily. As an extended release tablet initially 0.5 mg once daily. All doses may be increased gradually if needed and tolerated. Hepatic impairment severe, contraindicated. Administration. It may be taken with or without food. Side effects, for example sleepiness, drowsiness, may be reduced if taken immediately after meals. Contraindications. Severe respiratory insufficiency. Myasthenia gravis. Sleep apnea syndrome. Acute narrow-angle glaucoma. Severe hepatic impairment. Concomitant use with strong CYP3A inhibitors, except ritonavir. Special precautions. Patients with depression, suicidal tendencies, psychiatric or personality disorder. Respiratory disease, history of drug abuse or acute alcoholism, patients who are debilitated. Obese, smoker, or risk of falls, smoking alprazolam poses risks to your respiratory system. Concomitant use with opioids, avoid abrupt withdrawal, renal and mild to moderate hepatic impairment, central nervous system depressants. Pediatrics not recommended. Pregnancy contraindicated. Lactation contraindicated. Elderly, the dose should be reduced. Drug interactions. Cimetidine, fluoxetine, ketoconazole, and itraconazole reduce the clearance, hence dose should be reduced to 1/3. Alprazolam enhances the action of imipramine and desipramine. Potentiates action of alcohol and CNS depressants. Side effects. Anterograde amnesia and concentration problems. Ataxia. Slurred speech. Drowsiness. Dizziness. Lightheadedness. Fatigue. Unsteadiness. Impaired coordination. Vertigo. Dry mouth, infrequent. Hallucinations, rare. Jaundice, very rare. Seizures, less common. Respiratory depression. Suicidal ideation or suicide. Muscle weakness, urinary retention, infrequent. Skin rash. Constipation. Overdose. The maximum recommended daily dose is 10 mg per day. Overdoses of alprazolam can be mild to severe depending on the quantity ingested and if other drugs are taken in combination. Alprazolam overdoses cause excess central nervous system, CNS, depression and may include one or more of the following symptoms. Fainting. Somnolence, drowsiness. Coma and death if alprazolam is combined with other substances. Hypotension. Low blood pressure. Hypoventilation. Shallow breathing. Orthostatic hypotension, fainting while standing up too quickly. Impaired motor functions. Dizziness. Impaired balance. Impaired or absent reflexes. Muscle weakness. Withdrawal symptoms. In general, symptoms of acute withdrawal from alprazolam can include anxiety, panic attacks, hyperventilation, tremors, sleep problems, muscle spasms, loss of appetite, sweating, general discomfort, hypersensitivity to light, sound, or touch, the sensation of being detached from your body, seizures, psychosis, including hallucinations, delusions, and delirium, a type of severe confusion. Avoid drinking alcohol and using illegal drugs while you are taking alprazolam. They may decrease the benefits, for example, worsen your condition and increase the adverse effects, for example, sedation, of the medication. Brand names that are mostly prescribed by doctors: Alprax, Ancit, Restil, Xanax. A frequently asked questions. Alprazolam versus Diazepam. Diazepam is an inexpensive medication that works well for anxiety and muscle spasms, but it's not meant for long-term use. It can also be used along with other medications to help manage seizures. Alprazolam works well for occasional or short-term anxiety and panic attacks. Combinations: Alprazolam and sertraline, which has anxiety-lowering and mood-enhancing effects. Alprazolam is a benzodiazepine, BZD, that increases the action of GABA, a chemical messenger that suppresses the abnormal activity of the nerve cells in the brain. Sertraline is a selective serotonin reuptake inhibitor, SSRI, that increases the levels of serotonin, a chemical messenger that improves mood. Mechanism of action: Alprazolam is 80% bound to serum protein, mainly albumin. Alprazolam is metabolized in the liver by cytochrome P453A4, CYP3A4, to 4-hydroxylprazolam and alpha-hydroxylprazolam metabolites. Alprazolam and its metabolites are filtered out by the kidneys and excreted in the urine. Thanks for watching. Please subscribe and like this video.